Good afternoon, I'm Mabel Jung, and you're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. We're on day one of the event, and I'm very pleased to have with me in the studio David Newman, Executive Director, Healthcare Cost Institute. Hello, David. How are you?
I'm fine. Thank you very much.
Well, the theme of this conference seems to be transparency. We certainly know a lot more than we did 5 years ago. It seems to be getting a little bit more clear what things cost. But are there now challenges associated with having all of this information?
There are challenges. We started with price transparency around the two CMS Medicare data releases. In one of those data releases, CMS issued what are referred to as the charge masters, which are the amounts that hospitals would like to get paid for services. That's very much like the sticker price on a car. It's not the actual price the dealer receives, it's the price the dealer would like to receive. That certainly got a lot of publicity, and then about 9 months after that, CMS, the Centers for Medicare and Medicaid Services, released basically profiles of providers showing which doctors or other providers were providing a lot of Medicare services or billing for a lot of money, and that too provided some degree of transparency into the Medicare program. What we're now moving into is transparency with respect to commercial insurance, the types of insurance that most of us receive through our employer, or the types of insurance that people are consuming on the exchanges. And understanding price and quality information there is a little more difficult and far more valuable to consumers because they're market-determined prices.
Okay, so now that we have some sort of baseline about what organizations want to receive, how does that help the consumer?
Well, much like any, and I'll put my healthcare economist hat on for a moment. In most markets, we expect consumers to go out and look at the price of a good and the value or the utility that they have in consuming that good, the quality of that good. And historically, both price and quality information weren't available for healthcare services. But we know that that information is critical for any properly functioning market. It's not going to all of a sudden be a silver bullet for healthcare, but it guides consumers in making decisions about care decisions, about places to seek services, and it's a necessary prerequisite for a good functioning market. There are lots of other problems in healthcare markets that this will not solve, but it's a necessary precondition.
So where do you see us going from here? What's the next stage?
Well, and the Healthcare Cost Institute about 2 weeks ago launched its first consumer website. We hold all of the data for about 50 million Americans in this country, and we launched what's called guru.com, G-U-R-O-O.com, and we're providing granular price transparency to consumers in 42 states in the District of Columbia for about 78 different types of services. We're going to grow that out over time to, by June, add another roughly 200 prices to that, but even with and we hold over 3 billion claims for purposes of public reporting in Guru. It's not enough data. There are places where we don't have enough data to report on particular services or particular prices or in particular locations. So the challenge going forward is to have a lot more data so that consumers can begin to shop on price and then add to that quality information.
Do you foresee also consumers becoming more educated on what questions to ask?
Yes.
And where will this come from?
We've launched the website with actually a section on it called Questions to Ask Your Provider. I'm a healthcare economist. I have a PhD and a JD. I had a couple of stitches put into my cheek a while back, and I'm a member of Kaiser, and I was out of network, out of location, and I had to go figure out how to shop to have these 3 stitches removed. And it was a very difficult thing, even for somebody that lives in healthcare, to call up and ask about prices. So we believe it's very important to provide consumers with information on how to shop. And when I say shop, engage with your provider on a discussion around price and quality. But at the same time, through the website, there's a necessity to train providers on how to respond to consumer inquiries so that there's a fruitful discussion that goes on between providers and suppliers. And it's our goal to work with professional associations to put that information up for providers and also to work with consumer groups to put that information up for consumers so that when they approach one another, it's a fruitful discussion rather than I don't want to discuss price.
Are we also adding to the confusion when providers change the pricing midway through the process of billing?
Yes.
So you get one price and then you get billed again for another price, and your benefits person is confused and they've already paid the first price. So where will that pan out?
This exactly happened to me, if we can go back to my stitches. They coded me as a very low-level office visit, but as a pre-existing patient. And I paid $65 to have the stitches removed, and 2 weeks later I get a supplemental bill for $20 saying we miscoded you. One of the problems with price transparency is really we're asking consumers to know a lot about what services they're going to require going into the doctor. It's much like you and me thinking my car has some noise, and we're asked ahead of time to diagnose the problem to get a sense of the cost and then choose a provider. Well, you may be far more knowledgeable about cars than I am, but I would not know how to begin to diagnose my car, and similarly, I don't know how to diagnose my own healthcare conditions. Price transparency and quality transparency are guides. We're never going to be able to tell a consumer with certainty what the doctor, ahead of time, what the doctor is going to need to do when they come into the visit. The doctor may all of a sudden conclude in the medical record that you didn't have your flu shot, and you need your flu shot, and that's going to add a cost, and you're going to leave the office with a higher bill than you anticipated going in. These in large part become reference prices. There is always the possibility that we redesign the entire healthcare system and move that risk from the consumer back to the provider. Where as a consumer, you pay an average price for a typical visit, regardless of what services you get, and the provider is paid an average price. In this country, medical providers sell services by CPT codes, by procedure codes, but what consumers want to consume is health. And those two don't often match up.
So will we ever be at a place where consumers just say, no, I'm not paying that?
I don't think so. We so value health that at the end of the day, at least until human nature changes, for many of us, we go in, even when we're old and we're sick, my desire is to live long enough to see my grandchild's marriage or my grandchild graduate, and we're willing to pay with the hope that we're going to get well. And there's an eternal optimism to that.
Absolutely.
That is important.
And any final message or takeaway you want to leave with us, David?
I think we've covered on it, and that is transparency is an important aspect of the healthcare system. It's not the silver bullet. There are many other things that we need to do to improve the healthcare system. Transparency is one of them.
Okay, David, thank you so much for your time today.
Appreciate it.
And I'm Mabel Jong. Thanks for watching.